there's options for surgery that is offered to women depending on the different biology of the breast cancer, and so it's really planning whether we do breast preservation or mastectomy, and what we do with the lymph nodes under the armpit. And again, that's done in consultation with the woman and her support team, and we like to have surgery done within 2 to 3 weeks of their diagnosis.
The hiatus between diagnoses and the operation is huge and empty, and you don't know anything, because they don't know how bad it is until they get in there. They don't know how big it is. They don't know what your treatment is going to be like, and you don't know if it's moved. And I was actually too scared to even touch it in case I shunted something off that went sweeping around my system.
My husband and I had kind of talked about, in the worst case scenario, if ever it meant a mastectomy, I can remember saying, look, I'd rather have my life than my breast, which was a very prophetic words actually, because when I was in theatre and it was discovered that the cancer was worse than first thought, the surgeon rang Ian. The decision had to be made. In fact, Ian made that decision while I was in theatre on my behalf, and it was absolutely the right decision to make.
Even though I said cut it all off, he said no, let's look at breast conserving surgery. And I didn't understand the importance of that at the time, and I do now. Go for the path that will give you the least stress at the time.
If the breast cancer is reasonably small relative to the size of the breast, then a breast conserving operation, a wide local excision of that cancer, is an option, and it's usually our preferred option, as long as we can get an outcome where there's a low risk of local recurrence of the cancer.
And as a result, I've got a good cosmetic result now, yeah.
The surgeon said to me that I only needed to have a lumpectomy, and I just wanted it gone. So I opted for a full mastectomy. He made me go back 3 or 4 times to make sure that I knew what I was doing, and I stuck to what I decided, and that's what happened. And because of that, I didn't have to have radiation, because I chose to have it all off. So that was a kind of a bonus, I guess.
The surgery was absolutely painless and straightforward. So I don't remember any pain from any of the surgery.
I was in hospital for a night. I took a couple of days to sort of get mobile properly, and I was back at work within a week and a half.
The surgery went fine, but it was the aftermath with the drain bottles. I had 2 of them at one stage, carrying around in a pillow slip.
As far as having my breast removed, it didn't bother me if that was what was going to have to happen, and my partner was in full support. He, was going to love me either way. But my surgeon just said, I fully believe that a partial mastectomy is all you need to have, and and we went in there saying that we're going to have a partial mastectomy. If you get in there and it's worse than what you thought it was going to be, then take it. Yeah, it's only a boob at the end of the day.
Originally it was going to be a lumpectomy. I was also told if it's outside the area that they want to work in, further surgery would take place, which that did happen 2 weeks after the lumpectomy.
The cancer had moved to the chest wall, not deep, but enough concern for the oncologists to say we want her to go back in and have that wide excision procedure. So that was fine.
They did a partial mastectomy, which is probably just a lumpectomy, and there was no lymph involvement, well, even though they took 17, I think. The worst part of that for me was the lymphedema afterwards.
I cope with it as well as I can. I find it very frustrating. The lymphedema is quite common if you've had an infection following your surgery, and I did. It was quite a severe one and got really, really sick. But as long as you keep up your exercises and look after yourself and have regular lymphatic drainage done, makes it a lot easier to deal with.
Lymphedema can strike at almost any time down the track, and I just do everything possible that I can in terms of preventing it. One of them is the massage, lymphatic drainage massage, which I do every morning.
Well, the nurses at the hospital definitely they push that the importance of exercise and try and keep the arm moving and using it and so forth. Plus, I went to Pink Pilates, which I still do now, and that's helped strengthen it as well.
When I got out of surgery, the first thing I did was look at my arm. And when I noticed that it wasn't swollen or anything, I was relieved, actually, because that was one less thing, I had to worry about or think about.
It was all very surreal, actually. It wasn't at all what I expected to happen, and but all I knew was I had total trust in the surgeon who'd performed the surgery.
I still struggle even now just with the look of my chest.
When I had the operation, I didn't look at myself, well there anyway where the operation was, and it took over a week, I think. I remember not wanting to look at it at all. It was a shock, to have something removed and then nothing there. You just don't feel normal. Some days, you kind of, sometimes I think, oh yeah, nothing to worry about, and then some days you just look at it and you're in the mirror and you go, you kind of feel sorry for yourself.
When you actually look down and that's you, like that person in the box, not you, but that's you, I just burst into tears. Well, I thought, well, I'm going to have to see this, twice a day, so just get used to it.
But most days, looking back from then to now, it's better. It does get better. It just takes a while.